read a lot of Crane's Health Plus, and there was a headline that said New York races to prescribe groceries and Uber rides in a Medicaid experiment. I know you're like, what does Uber and Medicaid have to do with each other?
Facts.
In this particular case, a box of fresh produce, new air conditioning unit, and an Uber to the local farmers market that aren't typical medical benefits. But New York, they're trying to get Medicaid enrollees under a $7.5 billion experiment to see if this would be a way to address some of the social needs. Now, this isn't a new program. It's known as New York Health Equity Reform under the 115 waiver. You all can go look that up at your leisure. It's backed by the federal government and aims to prove out the theory that paying for things like groceries, housing, and transportation can keep patients healthier over the long term, ultimately reducing the state's cost of covering Medicaid members. So, what does that mean? Let's take my neighborhood, for instance. There's not a lot of fresh farm and produce here. 9 times out of 10, the quickest thing we get access to is fried chicken, fast food, things of that nature. That can lead to healthcare conditions, that can lead to chronic illnesses because people are not putting healthy things into their body. Therefore, that can only lead to routine of hospital visits, and that just drives up costs. Why don't we make sure that we give them access to healthier food and resources? Maybe, just maybe, if it's not genetic, they will stay out of the healthcare offices and out of the EDs because they're treating their bodies better.